trying to make our workers and families safer in this pandemic era. First, the information is not specifically aimed at engineering contractors. We put that out when we first did the flyer. Then after talking to Keith Woods, and I'm sure we've got some home builders on the call as well, it's intended for all workers still working in essential jobs out there. So what we're going to be providing today isn't specific to engineering contractors. The second point I wanted to make, protection of workers is obviously our goal, but I want to address this because we're pretty fortunate to be out there deemed essential workers. Public perception is a motivator for this webinar, I'm not going to lie. Public health staff are making, for the most part, decisions as to what construction and service jobs are essential and which are not. We don't want to be out in the public demonstrating a lack of social distancing or a lack of wearing PPE when others driving by are shut down. That could lead to disgruntled people calling in and eventually shutting us down. We don't want that. Safety first, but we got to keep working too. So we're trying to kill two birds with one stone with this. We need to set a good example. To that end, I will now hand it off the mic over to Jared Goble of George Petersen Insurance, and he's got Jim Persons as his wingman. And Jared, take over, please.
Hey, thanks, John, and thank you for going ahead and spearheading this and starting it up. As John mentioned, my name is Jared Goble. I'm with George Petersen Insurance Agency. I'm going to be talking about some practical tips here that we can implement for our construction sites. And then when I'm done, Jim is going to talk about some specifics on PPE usage, particularly with the N95 there. As we have on the screen right here, for those that are logging on, just go ahead and put your system on mute there. We will open this up to Q&A at the end, but I'll make it go streamlined there. I am recording this, so we will have this be able to play back if we want to share this with coworkers after the fact, and I will also be sharing, and so will Jim, all of the slides from today's presentation with John, so the ECA can go ahead and distribute there. As John mentioned, the goal of this one is for protecting employees. We also want to go ahead and protect the spread of this virus, but also we need to be setting an example out there as essential workers in the community following these guidelines. So I want to go ahead and start with a little bit of a disclaimer on this. At this time, OSHA has not put forth any new standards or requirements regarding COVID-19. What they are referring to is they put out some recommended guidelines that mirror that of the CDC. And in this, what they are doing is they're referencing the OSHA General Duty Clause. The OSHA General Duty Clause requires employers furnish a workplace free of recognized hazards that are likely to cause death or physical harm. In this case, it applies because we do have a recognized hazard out there that is COVID-19. So in this presentation, we're going to be talking about things that we can be doing to implement on our sites. You will find that a lot of this is stuff that we've been hearing about on the news, but it's important that we are going ahead and putting these things in place and looking at this from a little bit different perspective. Why this is a unique situation is oftentimes when we're looking at safety in construction job sites, we look at the safety hierarchy of controls. We figure out ways that we can engineer control or situations out. We can substitute, we can put engineering controls in place. With this pandemic, we are handcuffed on some of the controls that we can use. So a lot of this falls on administrative controls, changing up our job site practices, our behaviors, and unfortunately, a lot of this is going to rely on PPE usage, which Jim will talk about here in a bit. I know that social distancing is going to be tough for a lot of us based on the work and the job sites that we're on. And that's where PPE is going to be that fallback measure that we're going to have to take in a lot of situations. And as John mentioned, one is protecting our workers, but two, it's also the public perception that we're facing. One thing I wanted to start off with is what do we do as employers if we have been notified that there is a worker who has a verified positive test for COVID-19. So the steps that we need to be taking on that is that job site does need to be shut down immediately for a period of no less than 14 days or is otherwise directed by the local public health agency. For a lot of us, that's going to be Sonoma or Marin counties. They will be notified in the event that this does happen. If that is the case, we need to make sure that we are doing decontamination of that job site. So highlighting all common surface areas, high contact areas, toilet, hand washing stations, handrails, doorknobs, anything like that, and make sure that they are completely disinfected as a part of that job site cleaning. One thing that we'll be talking about, and this is stuff that needs to get communicated to employees, is the route of entry of this virus, and it can live on surfaces. So it's important that we have everyone on the same page of what the possible exposure methods are there. Anyone that has been on that job site should be informed that it's recommended that they self-quarantine and then contact their medical provider if they start becoming symptomatic during that self-quarantine time frame. And we'll talk here in a bit about what those symptomatic measures should be looking for. One of the big things on this is our responsibility is getting our teams engaged in what they should be looking for so people can self-diagnose and for our managers and supervisors to be keeping an eye out for possible cases as well. Subcontractors, other trades, other people that have been on those job sites in contact with people, deliveries, what have you, should also be informed on this. One of the things that's interesting with this is typically when we're dealing with illnesses and injuries is there's many privacy things that come into play, especially dealing with OSHA 300 logs and HIPAA. On this, we want to make sure that we are notifying as many people as possible about possible or convicted cases so that we can go and do some retroactive forensics to see who's actually been exposed and what sites need to be cleaned in that way. We don't want to be in a situation where we're punishing, embarrassing, or setting out on employees, but it's simply one of those, they aren't getting this by a fault of their actions, and we need to do whatever we can to go ahead and prevent the spread. If there is a positive case on the job site, we should go ahead and move that to the local health agency for any updates. This is a fluid situation, so there is constant updates and guidance there. So the local public health agency would be able to assist with moving forward there. One of the important things to talk about with both managers, supervisors, and employees is getting everyone on the same page on how this virus is spread. The most common way is from person to person. So we keep hearing about the social distancing guidelines of people in close contact 6 feet or more, or 6 feet or less. And the reason being on that is if you've ever seen that episode of Mythbusters, when people are talking, coughing, and sneezing, that range of bodily fluids is going out 6 feet and sometimes more to others. So if we do have a person with COVID-19 and they're coughing, sneezing, spitting as they're talking, those droplets can go out into another person's breathing zone, get inhaled, come into their mouth, nose, and lungs, and that is the primary way that this virus spreads. Now, on Friday afternoon, Dr. Fauci came out and actually started putting in recommendations for people being out wearing face masks. The Sonoma County Health Organization is talking about that as well. The big thing, and Jim can talk about that, is with face masks, that's going to be preventing the spread from that person to others, not necessarily helping them from out or exterior respiratory issues there. Now, while it's mainly from person to person, the virus can live on surfaces. So as we go through, regular housekeeping, maintenance, and disinfecting is important because it can live on surfaces. If employees are touching a common surface where that virus is present, and then they go ahead and touch their mouth, nose, or get into their body, they can go ahead and get it. This can survive up to 3 days on plastic and stainless steel, up to 4 hours on copper surfaces, up to 24 hours on cardboard, and suspended in a fine mist for up to 3 hours. Now, it's important on that, with that suspended and fine mist, one of the things that we'll be talking about is making sure that if we can move any sort of meetings to outdoor settings trying to avoid any congregation of people indoors. That'll help minimize areas that we need to disinfect, limits the potential of it suspended in the air as we get normal airflow and stuff that way. So what are some workplace controls that we can go ahead and put in place to be proactive on dealing with this? If we're dealing with subcontractor meetings, if we're dealing with trades, other things, what can we do to limit the amount of people on in-person meetings? Can this, in some cases, go digital? Can we email out agendas? Can we do things over the phone? What can we do to reduce in-person meetings whenever possible? If there are in-person meetings that we need to have, what can we do to put those outside? Again, outside of job boxes, trailers, offices, those are going to limit the areas that we need to disinfect and limits the possible of that staying in a contained area. If it is required that we're having meetings with others in offices, job trailers, this, that, and the other, those areas should be disinfected before and after the meeting is held inside. Inspections, if we are having people come out to do job walks and things that way, social distancing should be put in place. One of the big things to think about is maintaining a small circle. So what are ways that we can go ahead and maintain a small circle? Yes, we are going to have our crews out there working and sometimes in close quarters. But what can we do to limit that circle of others coming in? Is that going to be delivery people coming in? Can we make that no contact there? If we're having inspectors, what are things that we can do to limit and keep that a small circle for who we have? No handshaking or direct contact. Right before this whole thing kicked off, I was at a conference for safety professionals, and they err on the side of caution of everything. And it was a no handshake conference. And I know it's very weird talking with someone or meeting someone and not shaking hands, but it's really important that that is all limited right now. Daily housekeeping, as we talked about, again, indicating and highlighting what are going to be those common contact, high traffic zones in terms of hard surfaces, and making sure that they are getting cleaned on a regular basis. Same thing with safety orientations, keeping those outdoors when possible, moving those to digital formats if possible, eliminating the congregation or getting people together. One of the big things too, as we're looking to put in some of these different controls, limit and increase social distancing, seeking feedback from our guys and gals on the front lines too is always a great way. They might have some great ideas and tips and stuff for us, seeing things in a different perspective. The big thing is we need to be looking at what are the possible routes of entry for our job sites or for our crews and what we can do to eliminate those. Other workplace controls, I had the guys here sitting up on building the Empire State Building. Another thing to think about is how we are set up for lunches. If we are doing group lunches, settings, what can we be in an area where we can spread out, socially distance that area. Making sure that we are doing disinfecting on multiple times a day throughout the job site there. What can we do to provide some tools to our employees to help them keep safe? No touch trash cans, again, limiting contact surfaces there is a great way. If we can provide hand soap and hand washing facilities in the field, that's great. If we can't, alcohol-based rubs are a good second measure there. The reason that hand soap is the preferred method is when you get that lather of the soap, that actually breaks down the fatty membrane of the virus and actually kills it. So that's why they are promoting having a good lather and 20-second hand wash there. That's going to be the most effective way on killing the virus for personal sanitation. Again, what can we do to be creative? Can we do alternating job tasks or shifts, reducing the total number of employees at a job site at a given time? This might not always be practical, but what we want to start thinking about is what are ways that we can go ahead and keep that circle small, start thinking outside the box of what we can do to eliminate things that way. Very important that we encourage employees who are not feeling well to stay at home. We want to err on the side of caution at this point. One of the big things that we've been hearing about is people may be asymptomatic or they might be feeling those early onset signs. We do not want to have anyone that's not feeling well coming onto the job site. It can startle other people. It could be a spread there. The other part too is we don't want to be requiring doctor's notes at this given time because the healthcare system is so overwhelmed. So we want to be making sure that we're erring on the side of caution there. I imagine at this point we have eliminated most employee travel, but eliminating, again, keeping that small circle, not having employees on airplanes, trains, public transportation, where we're going to be coming in contact with more people. Right now, if you've gone to the store recently, we all know that there is a run on cleaning supplies. I had to drive to Petaluma yesterday just to find baby wipes. So we might not be able to get all the Lysol wipes and things that we need to go ahead and clean up our work surfaces right now. One good alternative to that is making a homemade bleach solution for disinfecting. A third cup bleach to a gallon of water, or for making it in a smaller quantity, 2 tablespoons of bleach to a quart of water is going to be a great disinfectant that we can use. Get that on the required surfaces out there in 10 minutes. That's going to completely disinfect. OSHA hazard communication is going to apply to that. Those things should be properly labeled, properly stored, and used in a responsible manner. But that is a good secondary option there for disinfecting our sites. So one of the big things that we need to be talking about with both our managers, supervisors, and employees is recognizing these signs and symptoms, both in ourselves and those around us, so that we can go ahead and determine if isolation does need to take place. So these are the common symptoms that may appear 2 to 4 days after exposure. But again, what we're finding is a lot of people may be asymptomatic. So the fever, cough, the shortness of breath is that dry cough, shortness of breath there. Those are going to be the warning signs that we want to make sure that those people are staying home. And if they are experiencing those situations, that they are getting reported to managers so we can communicate to other people if need be. Big warning signs that we need to go ahead and keep an eye out for, and these are ones that need to go and seek a medical attention immediately. People with trouble breathing, persistent pain or pressure in the chest, confusion, bluish lips, that dry cough, the fatigue, the body aches. As we mentioned earlier, OSHA and the feds are not providing much guidance on what needs to be done on a uniform approach right now. It's really falling onto employers to get creative on what they need to do to limit that. Before this, it would be unheard of to hear people getting their temperature taken before stepping foot on a job site. You're starting to see that now. Again, as a part of the general duty clause, it's what we're doing to make sure that we're protecting our employees. So you are seeing that for people doing the forehead scans before going on. Again, it's a way to be proactive for some people that might be asymptomatic. So what are supervisors' responsibilities in this? Right off the gate, we need to be following all requirements by federal, state, and local things. And back to John's point, for those of us who are deemed essential right now, that is a responsibility that we can't take lightly. So if we are out there working, we do need to be adhering to all the requirements set forth and practicing all those best practices, because we are highly visible to the general public right there. So as managers and supervisors, it's our goal to always be looking for potential safety hazards. In this case, what are going to be the potential routes of entry for this virus to come into our circle of employees or work sites, and what can we go ahead to do to eliminate those situations? Again, keeping the circle small. It is our goal and our responsibility to provide communication and training to workers and to communicate anyone that's coming onto our job site about the preventative measures that we're taking, so it's communicated there. One of the biggest things about this is having a good, clear, and concise game plan that we can communicate to employees is good. It takes away that unknown, it takes away that what if, and gets everyone on the same page, and it can really take a lot of the confusion out of it. It should be the role there, identifying and isolation of sick people. And if we are providing PPE to our employees out in the field, we need to make sure that we are training them on the proper use, disposal, inspection, and limitations of that. Jim will go into some more specific on the N95s there here in a bit. So what do we need to be doing for identifying and isolating potential cases? So we need to be encouraging that workers self-monitor. So having communication with them so they understand what the warning signs are and the symptoms of this are, so they know what to report, but also for supervisors to be keeping an eye out there. If there is a person who's potentially infectious or suspected of being potentially infectious, what do we need to do? One, we need to get that person into a location away from other people. So isolate them right out the gate. Provide them a mask if feasible and available. Now, Jim will talk about the N95s there. One of the things we mentioned earlier is the face mask. Getting any sort of mask covering on that person there is going to help them be a potential transmitter. So it's going to help keep it isolated on them. So getting something on that person. We're going to restrict the number of people coming into contact with that person and have them safely removed from the premises and encourage them to go contact their medical provider if they are showing those warning signs. And again, if that is going to be a confirmed case, we go back to the steps on slide 1. Again, this will be available for everyone for distribution later on. So training. So quite often we think about training out there, fall protection training, heat illness training, traffic controls. Right now, the big focus should be on training with employees on what the latest recommendations are with COVID-19. So communication about the disease, the routes of entry, things that we were talking about earlier, and the protective measures and controls that can be used and that you are using. Again, so that there's no what ifs or confusion there. Again, on PPE, if that is something that we are implementing, making sure that we are doing training with employees so they know the proper use, limitations, inspection, storage, and disposal of those items. Jim will get talking here on respirator training here in a minute. So where do we go for training resources on this? Right now, I would recommend people going and taking a look at the CDC homepage. The CDC has put out several PDFs that can be used as workplace trainings, available in both English and Spanish. There's several of those that are available. Cal OSHA does have the COVID-19 guidance. It does have a page up for that on their homepage. Again, most of this is mirroring what the CDC is recommending right now. I would also encourage people to go over to our George Petersen homepage. We have a whole section there for business as a business resource center of what's going on latest updates. We have also taken trainings on the coronavirus from our online risk management platform, both in English and Spanish, and made those available to the public in PDF form. So if you go over onto our homepage right there and click on to the COVID-19 resources, you will have links to both the CDC trainings and the ones from our things. So those are great. You can turn those out into the field. It talks about the warning signs, it talks about the different controls that put in place, has sign-in sheets right there. You can even use those as workplace postings. So the big thing that we need to be thinking about is making sure that we have communication with our employees, getting them trained on understanding the routes of entry, how this spreads, the potential ways that we can go ahead and limit that, what we can do to keep our circle small for our employees and for our job sites as we go in. As we looked at that safety hierarchy pyramid at the beginning, unfortunately, what we're relying on here is mostly administrative controls and PPE. These workplace controls are going to be examples of administrative controls. I will let John or Jim here talk a bit about PPE requirements specific with N95s here.
All right, Jared, thanks so much.
Hey, Jim, can I jump in real quick? John Bly here.
Go ahead.
Before you get
Go
going.
ahead.
I just wanted to point out there's a couple of us that understand the chat line, and I'm thinking that as you're talking, Jared, you might look at the chat questions and try to answer some of those questions. And then we'll also try to include all of that in the storage of, you're recording this, so we'll try to include all of those questions and answers for people to access later. So I just wanted to get that in real quick.
Perfect.
Okay. Good morning to everyone. I'm Jim Petersen. So some of you may know me as the safety liaison for the Engineering Contractors Association, as well as the North Coast Builders Exchange. And I want to thank Jared and the folks at George Petersen, John, for putting this webinar together. And we hope that it's some information that will help ensure the safety of your workers out on that job site. So if you want to go to the first slide then for me, we'll talk about the proper fitting and use and storage of respirators, the N95 respirator. And Jared, if you'll move that over.
Yep.
So right off the top, all of us are quite familiar with this N95 respirator. We've been using it for decades relative to fires here in the North Bay, as well as on construction job sites where there's exposures to everything from metal fumes to dust or biological particles such as the virus, that we're confronted with right now. You can wear one when there's been a virus outbreak in your area or pollutants or fire have made quality very poor. An N95 respirator, they're made of a structured lightweight foam. They fit over your nose and mouth as well. One of the important things is selecting the right size of the respirator. So what I want to encourage you to do on the next slide is to select the right size. Try on different sizes to get the best fit. Depending on the particular N95 respirator you choose, available sizes range from extra small and small to medium and large. I'm going to pause here because I know that the question out there is, where can I get this equipment? And I know John has done some research on it, and as we go to the Q&A element, we'll try to give you some resources, but we know how difficult it is today to get this type of respirator. If you are using it and issuing them to your employees, if possible, try on a couple sizes. Make sure the respirator feels snug, doesn't slip on your face. Remember that you'll also mold it to your face for an even tighter fit. If you're not sure, go to a smaller size and make sure that the respirator won't fall off your face. Next, facial hair. This is always an issue. I do a lot of fit testing for air purifying respirators and also this N95 respirators out in the field. And one of the big issues for our construction workers is facial hair. So what you need to do, guys, is you need to trim that facial hair before you're wearing this N95 respirator. If you need to wear an N95 respirator, shave off all facial hair that may interfere with the sealing edge. And you need to shave every day to give yourself the fit that you need. Mustaches and goatees have got to be trimmed to make sure that they're inside of the sealing edge of that respirator. As it says, the facial place the respirator in the palm of your hand so that the straps face the floor or the ground. Cup the respirator in one hand as the illustration shows. Place it over your mouth and nose. Set it over your nose and mouth with the nose piece fitting over the bridge of your nose. The bottom should go just under your chin. And remember to try to touch only the outside of the edges of the respirator to keep it clean as well. Proper placement of the straps of the N95 respirator. Next is first, you want to take and pull the bottom strap over your head, secure it around your neck, just under your ears. You can see by the illustration with the gentleman with a hard hat on. Make sure you continue to hold the respirator tightly against your face with the other hand, and then pull the top strap over and set it above your ears. And that's critical to make sure that you're able to take and adjust the respirator when you do your actual fit test. Fitting the respirator on the next slide. Mold the nose piece around the bridge of your nose. First thing you want to do is set your first two fingertips on either side of the metal nose clip at the top of your respirator. Run your fingers down both sides of the strip, molding it along the bridge of your nose. If your respirator doesn't have a nose piece, simply make sure that the fit is tight and snug around your face around your nose, because you will have some respirators that don't have that breathing aperture on them that are N95 respirators. So next, let's talk about fit testing. The very first thing that you want to do is breathe through the respirator and test for leaks. Set both your hands against the respirator. Take a breath to make sure that it seals against your face. Then exhale, feeling for any leakage from the nose piece or around the edges. If you feel any air leaking from the nose area, then you want to remold the nose piece, that metal bar that's at the bridge of your nose. If it's coming from the edges of the respirator, adjust the placement of the straps on the sides of your head, either up or down. And if your respirator still isn't completely sealed, then we encourage you to try a different size or model, okay? Removing the respirator. Remove your respirator by pulling the straps over the top of your head, as the illustration shows. Without touching the front of the mask, pull the bottom strap over your head, let it hang down over your chest, then pull the top strap over, and avoid touching the respirator itself so that it doesn't become contaminated. And then, last of all, talking about the storage of the respirator as well. And this is a question that's come up quite a bit over the last several days in several different industries, but the data that we get, the information we get is that rewear your respirator as long as it stays dry and it fits tightly. If you're using the respirator to protect from environmental hazards and it hasn't come into contact with harmful germs, it should be fine to wear again. Don't wash your respirators, that'll degrade the materials. You want to test the seal of your respirator each time. You put it on to make sure that it fits snugly, and then store your respirator in a clean sealed container or a Ziploc bag and make sure it doesn't get bent out of shape by surrounding objects. So that concludes my part of the presentation. A couple thoughts that I want to add there is I had a conversation this morning with a Kalos engineer, and I will share with all of you out there in the construction industry that yes, they still are making job site visits out there. And the Kalos engineer I spoke to specifically talked about personal hygiene, as Jared just indicated and demonstrated in his presentation, talked about washing facilities. One of the things they encouraged was that if you're using washing facilities or porta potties, that maybe you need to increase the number of services to those units during the course of the week. And of course, we've emphasized the social distancing as well as cleaning the equipment to make sure that it's safe for everyone to use. With that, Jared, John, I'll turn it back over to you.
Thank you very much, Jim. I hope people find that helpful. I'm seeing some questions and stuff coming up here in the chat. I was clicking through these slides here for Jim, so I'm trying to catch up to this. At this point, I would like to put it open for a Q&A here if people want to ask some questions there. I'm seeing some of these getting answered by others in the chat as well. If anyone wants to jump in. I'm seeing here John Catena talking about the N95s can be sanitized by placing a respirator in a 170-degree oven. There was just a publication in the by the Kalos Reporter that came out on Monday, I believe, and it was talking about two different methods for sanitizing the N95s. One was the oven method that you had mentioned. The other was a steaming method. So there are some reports out there of some things that are recommended there. Again, on that, to Jim's point, that regular inspection should be done on those if that method is being used, making sure that that process isn't degrading the respirator, making sure that we're doing a very thorough inspection on those afterwards so they aren't compromised.
Hey, Jared, I know that
Pamela. Oh, go ahead.
I know that the focus has been on masks, but I haven't heard much about the disposable gloves. And I know Kirkwood Bly used to use them by the boxes, by the cases. And I'm just wondering, can people still get a hold of the disposable gloves so that you can wear those? Maybe clean off your truck surfaces as the 2 or 3 people ride in the truck to the job site, and then toss those gloves and get a new pair? Are we finding out there, guys, that you can still buy the boxes of gloves?
Well,
you know, I'm not up to
the same thing with.
Go.
Yeah.
Go ahead.
Basically, the same problem with the N95 mask or the surgical mask as well too, is that it's difficult to find them out there, even to order them online, because they're providing them to the hospitals and first responders as such. But that's a good point, John, because a lot of times people will use those surgical type gloves, those nitrile gloves, underneath their regular work gloves, and now, for the purpose of cleaning surfaces, it's very important to take and have those available for the workers as well. Jared?
Pamela, I saw your question in there about the resources on this. This whole webinar is being recorded, and we're going to be passing along these slides to the ECA for distribution. So you'll have full access to all of these.
I see where Mary just made a note that she had contacted Whitecap and BWS, and they're sold out locally of both the gloves and the mask as well too. And that's unfortunately the case right now for many distributors.
And again, that goes back to the point of practicing good personal hygiene out in the field there, getting employees understanding that the routes of contact and the routes of entry there. So personal hygiene is going to be of the utmost importance out in the field.
There's a couple of chat points on there that found one supplier that still has some N95s. I found an alternative the other day. Mike Brown Electric was calling me about N95s, and he found Sonoma Design Apparel will make them to order with your company logos on them, about $1.90 something. And I don't have their phone number, but that was 2 days ago.
John, I did see your question in there about large job sites and high-profile job sites. What do we do on shutdown measures with that? That's in situations, one of the things, if there are confirmed cases, of getting the health department involved with that, so they would be able to help provide guidance. Basically what you would do is saying, if we had a confirmed case, these are the response measures that we took in terms of disinfecting. This is the scope of where it was, and then they could help advise on when things could resume based on those response measures. So the 14 days there is a requirement, but it's or as the health department advises. So that could vary depending on their response.
A question for Jim Persons.
Yeah.
You're in your conversation with Cal OSHA the other day. Did it come up that we can't get a hold of these N95 masks? So in many cases on a construction site, whether you're sandblasting or whether you're using, cleaners or whatever it is on stair treads or handrail, are they going to waive? What do they do? They can't waive the requirements for it. No, we can't get it. We can't do the work.
Right. And I just saw a couple of questions that came up. Mary had one as well too about the use of bandanas or scarves or whatever. You can see that people are becoming real innovative. And Jared, jump in here with me as you will. They're becoming very innovative about face masks and, doing their own. The key is to make sure that, as you talked about with the illustrations earlier, is that you're not projecting those, that particles and stuff. And so you can be innovative about trying to take and, eliminate the hazard of coughing and, spreading those germs by using bandanas or some other type of face mask.
The really important thing for people to keep in mind on that, and I've had this and I've had to school several clients on this because they want to go ahead and get N95s for everyone in the office. And the big thing to keep in mind is we need to reserve the N95 respirators for employees that are going to be experiencing atmospheric hazards as a result of their job. So that should be reserved for people that are doing cutting, blasting, are going to be exposed to things out there in the field, because that's protecting the employee from atmospheric hazards. The bandanas, the face masks and things that way are a way for them to help prevent the spread from them to others. So that's going to be for people that are going to be traveling in trucks together, that are going to be in office environments together that way. So that's a way to prevent that. But we do need to make sure that we're not just I hate to say wasting resources, but using resources there where it's taken away from people that actually need them. So understanding the difference between a respirator and a face mask for protection there is very important.
Right.
A question for Jared and Mary. I know you're back on here. George Petersen's going to send us a copy of the PowerPoint. Will we also have a copy of the chat questions and comments that we could then include and distribute to everybody? How are people going to get it, Mary? That's my question.
So
I don't know if Mary's on here or not.
Yeah. Are you asking me?
Well, the question is, George Petersen will send us over the PowerPoint. First question for George Petersen: will it include the chat comments? And then the second question: once they send all this over to us, whether it does or doesn't include the chat, because if it doesn't, I think we ought to type it up and have it available to people.
I can go ahead and
good information.
I'll put the chat in on the.
How do we distribute it to people that want it, Mary?
Well, we can put it in our newsletter, put it on our website. They can email me and request it, and I can send it off to them once George Petersen sends it to me.
So the easiest
Why
way
don't you
is for
put your
somebody.
email in the chat?
Say
Excuse
again?
me?
Why don't you put the email there in the chat right now so people know where to reach out to you to contact for the slides?
Yeah, and I'm thinking, Mary, the best way to distribute this is via our newsletter. People can send a message into you, ask to get on our newsletter mailing, and we can put this out on several occasions over the next week or two.
Yeah.
We just had a chat question from Pamela, who said that I believe it's Charles McMurray Company in Sacramento. Charles McMurray Company has dust mask or mask as well as gloves available. Okay, someone else?
Any other questions on there?
At this point, I think we got everything covered as well as we could. If people want to get
Well,
back
I got
to
a quick
us,
question, John,
let
for John Harris, about the regular masks that you're using for silica. I imagine you're talking about the full or half-face respirators there. Again, those would be ones that we'd want to keep for workers with those potential hazardous exposures, the atmospheric ones. But those are a good alternative as well. You're actually seeing those getting adopted into the healthcare world right now just because they can't get the N95s.
John Harris, yes, those are 100 protection on those air purifying respirators that you're using, so those suffice.
Great question.
I was going to say that I think that there's some powerful exchanges going on here. So Mary and I will talk about how to best keep the chat aspect of this going. I don't know whether we can put something on our website or what, but I do believe people are going to continue to have questions. And as this thing continues to shift, the folks in Sacramento are going to run out of masks and gloves. There's going to be other alternatives that come out there and so forth. So again, I suggest that all of those listening who aren't on our newsletter feed, it's sent out digitally. It doesn't cost you anything. So let us know by contacting Mary or myself. My email is john@nceca.org.
And mine, go ahead.
Very creative. What is yours, Mary?
Mary@nceca.org. MARY.
Why don't you guys throw those in the chat too? And I just set mine in there. If people want to reach out to me directly with questions as well, at this time, I'd be happy to help.
Appreciate it.
Mary,
Gang, we're all in this together. Jimmy, you do the same thing on chat too, please.
Yes.
And I can't thank you guys enough for participating today.
Hey, John, thanks for setting this up. I'm going to stop the recording on this here, but I'm going to hang out on this chat a little bit longer if there's other questions that do arise. And then I'll go ahead and put all these chat questions in on our final slide.
That's awesome. Thanks,
Oh,
Jared.
that's great. I took pictures of them.